Unprotected sexual intercourse. What next? What are you going to do to prevent the unwanted outcome of unprotected sexual intercourse? You've just had a condom burst, or you didn't carry your contraceptive pills along with you, or unfortunately, you have been raped. How are you going to tackle this situation so that you don't land into unwanted pregnancies or even the sexually transmitted infections like HIV, herpes, or whichever the case that might happen? What are you going to do? Welcome back to the Nursing Moms. I'm Nurse Janet, and in this video here today, I want to share with you what you are supposed to do to prevent unwanted pregnancies and sexually transmitted infections after having unprotected sex within certain limit of time. Unprotected sexual intercourse can happen to anyone and again at any time. Actually, most of the time, this case happens in unprepared way. You really didn't intend to have this sexual intercourse, but again, you find yourself in this situation where you didn't carry your contraceptive pills along with you, or the condom busted, or even it was a forceful sexual intercourse. Yeah. So there are two outcomes of this kind of situation that you might find yourself into. The first one is that you can find yourself pregnant, and the other one is that you can get the sexually transmitted infections. What are you going to do to prevent this kind of situation? This is what I'm going to share. Let's start with preventing the unwanted pregnancy. Actually, these are sexual intercourse that has already happened, unlike in other contraceptives whereby you are planning to prevent. In this here, we need a plan B to counteract whatever will happen afterwards. So to prevent the unwanted pregnancy after a sexual intercourse, there are two methods that you are going to use to prevent this kind of pregnancy. Suppose there is some time limit that allows it. The first one is to use the emergency contraceptive pill. The commonly known one in the market is the postnatal. You have to take these pills within 72 hours after the unprotected sexual intercourse. Yeah. So time factor in this situation is very, very important for the effectiveness of this kind of method. The earlier the better. If you can get it immediately after the sexual intercourse, then the better. It only works by delaying or preventing an ovulation. There's a video about postnatal that I did previously. You can check on it to get to know much about the side effects like the sore breast, the changes in your cycle, and even how the failure rates and all that, anything about the postnatal. Let's get to the second method of preventing unwanted pregnancy after unprotected sexual intercourse. The second method is insertion of intrauterine device, the common copper T device, the IUD. Yeah, this is one of the most effective methods on Plan B. Remember, it works much as a barrier method, and you can get this within the first 5 days of having unprotected sexual intercourse. And again, it can stay there for up to 5 days. And after its function or its mission in your body, you can decide to either continue with it as your preferred contraceptive method, or you can decide to get it out. Just visit a health facility, get a skilled personnel, a healthcare provider to insert it for you. It's one of the most effective, at 99% effective, to prevent unwanted pregnancies. Unlike the postnatal that maybe has some failure rate, this too has some failure rate, but it's on the minimal side. Remember, it's much of a... The IUD works as a barrier method that prevents the sperms from meeting an egg. Yeah, that is how it works. The next big concern is on how to prevent sexually transmitted infections. Yeah, you've had unprotected sexual intercourse, and now you want to prevent if there is any preventable sexually transmitted infections. Actually, there is quite a number of sexually transmitted infections like the chlamydia, gonorrhea, neisseria. All these are treatable, but again, we can have the untreatable ones like HIV and AIDS. Quite unfortunate. You can have the herpes, the HPV. These other ones are not treatable. There is no cure for them. Now, what are you going to do to prevent any sexually transmitted infection. The first general rule after having sexual intercourse is always to pee, yeah, empty your bladder. These two will help in preventing the urinary tract infections. Clean yourself either using a towel, or you can take a shower, or you can clean the area just using plain water. It's quite important. These two will help any other infection that might arise from, yeah. So these are the general rule. After that, it's quite important to book appointment with the doctor. Visit any health facility that is available or near you. Explain whatever happened, like if at all you are suspecting or you are not sure of the health status of your partner, it's quite advisable that you go to visit the health facility, explain to them whatever happened, if it was a condom burst, if at all you didn't have a condom at all, so that they can see on how to help you. There is post-exposure prophylaxis drugs for HIV that you can be given within the first 72 hours, and you will have to take them within a period of 28 days to get the full protection. Symptoms of sexually transmitted infection always sets in on a later date. So from this, you might think that you are really okay, but this is not the case. If you start experiencing things like maybe foul smelling discharge or any change in your vaginal discharge, you can see things like maybe a boil or even any swelling around your genital area, the lower abdominal pain. There is quite a number of symptoms that will trigger your mind to go and visit the health facility. It's also advisable that you use condom whenever you want to have sexual intercourse to prevent any further transfer of these diseases. During the treatment period, it's quite advisable that you refrain from having sexual activities. If you can get hold of your partner, it's also very important that he or she too gets treated. And again, during the treatment, it's quite important that you comply. The drug adherence, you really have to comply with the drugs so that you complete all of them. Adhere to the drugs, take them accordingly, how they are supposed to be taken to get the full treatment. Yeah. Most important thing to note is that before having any unprotected sexual intercourse, it's always very, very important. Prevention is quite important. Then the most effective preventive method you can use to prevent either sexually transmitted infections or even unwanted pregnancies is use of condoms. Condoms are quite available, very cheap. You can get them over the counter. You can get them at the public dispensing sites. Just get some stocks in your bags so that you don't find yourself in a situation where you want to really enjoy yourself but you are out of condom access. Thank you.